Sarita Vihar, South Delhi. Completed MBBS MD from King George Medical College, Lucknow, and having the experience of 32 years. Dr. Rakhi Gupta is one of the best leading obs and gynecologists in India with international recognition. Gynae endoscopy surgeon, the recipient of unbeatable record of 36 gold medal, 14 silver medal, and innumerable national and international awards. So now, doctor is also visiting faculty at Apollo Cradle Royal, senior consultant at the Fortis La Fame, and visiting consultant at Daffodil by Artemis, Apollo Kailash Hospital, Delhi. So now I welcome Dr. Rakhi Gupta. Please start the session.
Yes, hello. Thank you for introducing me. I'm Dr. Rakhi, and we are here to discuss a chapter about management of dysmenorrhea and spasmodic pain. It is one of the most common clinical conditions that we encounter in our daily practice. And so, knowing about dysmenorrhea, the prevalence, how to manage, the clinical insights, and the medical safety. So, we'll be just discussing in brief. So when we have a close look of the spasmodic conditions of the abdomen, it basically because of the menstrual cycles, the pain is due to the rhythmic contractions of smooth muscle fibers, which leads to ischemia and pain and discomfort. It is seen in cases of fibroid, ovarian cyst, endometriosis, pelvic infections, urinary infection, which all lead to dysmenorrhea. Occasionally it is irritable bowel syndrome and PCOD also. For conditions, of course, reasons unknown, PCOD also causes dysmenorrhea in certain cases. So, dysmenorrhea are the painful pelvic cramps that are associated with menstruation. It can lead to negative emotional, psychological, and functional health challenges. So, when we classify dysmenorrhea, primary dysmenorrhea is recurrent menstrual pain with no underlying disease, and it is commonly seen in cases of age group of 16 to 18 years. While secondary dysmenorrhea is the menstrual pain due to an underlying condition or structural issue, commonly affecting age groups around 30 to 40 years. The common symptoms associated with dysmenorrhea may be pain in the lower back and thighs, fatigue, sleep difficulties, headaches, nausea, and diarrhea. Along with that, psychological symptoms such as anxiety, depression, irritability, nervousness, they may be seen higher in cases of ladies having dysmenorrhea. So, a highlight on the numbers and the prevalence. There are several symptoms that are associated. Overall, dysmenorrhea may be seen in India as high as 87% of the cases, and 3.8% of the young women have reproductive tract anomalies which may be associated with secondary dysmenorrhea. Associated symptoms may be abdominal bloating, joint muscle pains, abdominal pain is the commonest, dizziness, fatigue, and backache. The effects of dysmenorrhea is more on the quality of life. So, dysmenorrhea negatively impacts the quality of life more in adult women between 40 to 50. Of course, in younger also, because then there is a school absenteeism and work dropout from work, office, and all. There may be poor concentration. There may be affected social relationships. There may be uneasiness at work, poor sleep pattern, and overall affected emotional well-being. So, in a cross-sectional survey, it has been seen that absenteeism is a common factor which is seen in women, in which people drop out from the school and colleges during those days, and there is absent from work. The need for treatment and management of dysmenorrhea becomes important in such cases. So, the measurement is in the form of mild, moderate, severe dysmenorrhea, and the over-the-counter medications are available, pharmacological methods are available, as well as non-pharmacological methods are there. So, pharmacological methods are over-the-counter medication or medications that are received by doctor's consultation. Then non-pharmacological methods, usually these are the methods that the ladies have already tried before coming to us, and that is either in the form of rest, staying in bed, using hot baths or heating pads, then distraction, special food or drinks, and exercise. So some of the things work, basically rest, then some amount of fomentation, then exercises in the long run, they all have a special effect. But the medication, over the counter medication, is significant because overall 76% of the ladies seek over the counter medication, whereas only a small percent of them, they go to the doctor. So as I discussed, the non-pharmacological methods are active lifestyle, regular exercises, a balanced diet in the form of vitamins and minerals, and moderate activity, especially recommended in obese women. Apart from that, supplements may help, like taking magnesium. They usually help in neuralgic pain, such as having dysmenorrhea, also said to be useful in cramps of the legs, and also in certain migraine attacks also, which people get during this phase. Calcium, vitamin B6 and vitamin D, these are also helpful in such cases. So the pharmacological methods are in the form of painkillers, which are in the like NSAIDs, the non-steroidal anti-inflammatory drugs, and smooth muscle relaxants. These are effective medicines, but yet they may have adverse side effects also. The NSAIDs may cause heartburn, nausea, vomiting, diarrhea, dizziness, whereas smooth muscle relaxants have effect on central nervous system and anticholinergic side effects such as dryness of mouth, constipation, and some amount of palpitations, etc. So about 20% of dysmenorrheic patients also do not respond to NSAIDs. So paracetamol is a drug of choice considered to be a safe analgesic with superior gastrointestinal safety. So choosing a safe treatment, we need an anticholinergic that relaxes smooth muscle by targeting the muscarinic receptors, which is hyoscine butyl bromide. Paracetamol, which is a safe and tolerable analgesic with devoid of gastrointestinal side effects. So the hyoscine butyl bromide, the mechanism of action, as I said, it blocks the anti-acetylcholine at the parasympathetic sites in smooth muscles and secretory glands, hence inhibits the contraction. Then the pharmacokinetics, there's a limited absorption and bioavailability, does not cross the blood-brain barrier, so it doesn't lead to generalized side effects like sedation, etc. It is obtained from natural plant source and it reduces gastrointestinal and urogenital tract motility, effectively managing spasmodic conditions. So it is recommended as an antispasmodic by the RCOG for alleviating pain in procedures such like uterine artery embolization and other such uterine procedures. On the other hand, paracetamol, it is an OTC product, as we know. It is helpful in mild to moderate acute pain. It has an excellent tolerability. It inhibits the COX peroxidase activity at low peroxide levels. Inhibition mainly affects the central nervous system. It has minimal peripheral anti-inflammatory effects. So again, it is recommended as a first line of treatment for mild to moderate pain. The rationale of combining hyoscine butyl bromide and paracetamol, there is a comprehensive relief. The muscle spasms are reduced, the pain perception gets slower, and there is relief. There is a synergistic effect of both the medicines together. So, and there is a reduced risk of in such kind of patients. It has a broader application and it has a higher patient compliance. The efficacy in Indian patients. The post-marketing study has shown that 66% of the females have, with 37.7, have dysmenorrhea. The mean peak intensity scored is significantly reduced from 14.2% on the first day to 87.8% after 7 days of treatment. 90% of the patients have good to excellent resolution of pain and no adverse side effects were reported. Pharmacy-based patient survey also says that 50% reported onset of symptoms get relieved after 30 minutes or earlier, and more than 93% in in less than 60 minutes. So HPV and paracetamol significantly decrease pain and intensity and frequency. The pain intensity frequency gets significantly decreased. After 3 weeks, 15% more patients receive global efficacy of good and excellent in the combination group. So, hyoscine butyl bromide paracetamol and its combination was superior to placebo for pain intensity and daily pain frequency with a global efficacy score of over 23% greater improvement. Again, as I said, it is effective in post-procedural pains such as HSG, performing HSG, putting a IUCD, intrauterine device, or doing embolization procedures. Mild to moderate pains gets reduced with it. The HPV and paracetamol combination in treating GI symptoms in IBS patients. Now, since it is a antispasmodic, it has a good role, and as compared to dicyclomine and rotavirine, it has lesser side effects. So, hyoscine butyl bromide not only effectively improves symptoms but also possesses a favorable safety profile. The global effectiveness rating is 96% of the patients were satisfied, 97% had a global tolerability, and impact of GI cramps and pain was more than 50% of the cases. The safety profile: the hyoscine bromide is safer than dicyclomine and rotavirine. It has lower CNS effects and anticholinergic side effects, fewer adverse events, better tolerability and compliance as compared to dicyclomine, which has higher CNS and anticholinergic side effects, has adverse effects such as dry mouth, blurred vision and constipation, and has a lower tolerability and compliance. So, hyoscine butyl bromide, which is obtained from a natural source, has a favorable safety profile compared to dicyclomine. Again, now when we compare paracetamol as compared to mefenamic acid, paracetamol usually needs administration of concomitant PPIs. So we have to add some pantoprazole or omeprazole or any such kind of compound to prevent hyperacidity. Administration of food, it is said that you must have it after food. It gives a better bioavailability, and more so the gastric irritation is less. But chronic use or frequent use may also increase the GI bleeding risk. And then adverse effects such as heartburn, nausea, gastric ulcers are the end result. Whereas in paracetamol, it can be administered without PPI agents. It can be administered with or without food with minimal effect on the bioavailability. It has a lower bleeding risk and a higher safety profile, and rarer adverse effects such as the GI bleed and cardiovascular safety. What is DRESS syndrome? This is a new word which I encountered. And this DRESS syndrome includes drug reaction with eosinophilia and systemic symptoms and begins with malaise, itching, and fever. This can progress into skin involvement, that is morbilliform rash, diffuse scaling, facial edema and erythroderma, systemic involvement such as lymphadenopathy, hematological abnormalities, and organ damage. Now, there is a potential risk of mefenamic acid, including skin reactions, edema, respiratory problems, and its link to DRESS syndrome. The disadvantages of NSAIDs, as we discussed, it is adverse side effects towards the GIT, increased risk of GI bleeding, higher hepatotoxicity, elevated liver enzymes, thrombocytopenia, hypersensitive reactions, acid reflux, and discomfort. So, administration of concomitant gastroprotective agents are required to minimize the GI complications with NSAIDs. HBV and paracetamol, hyoscine butyl bromide and paracetamol, is a safe combination. Hyoscine butyl bromide, minimal systemic side effects, lacks central effects, making it safer than dicyclomine, fewer central side effects as compared to Simetotropium, dicyclomine, mebeverine, penaverine, and so many other anticholinergic agents. Paracetamol again is safer as compared to NSAIDs, and notably safety benefits as compared to traditional NSAIDs such as mefenamic acid. So this combination is having many indications, that is non-specific or specific colicky pains, irritable bowel syndrome, post-operative spasmodic pain, pelvic inflammatory disease, polycystic ovarian syndrome, endometriosis, urinary tract infections, and the pain of fibroids. So to summarize, dysmenorrhea prevalence in India is reported to be as high as 87%. Dysmenorrhea negatively affect quality of life of women. Absenteeism from school and work was found to be common parameter in Indian women, and the use of hyoscine butyl bromide and paracetamol have proven to be effective and safe treatment compared to NSAIDs and other antispasmodics. The initial treatment with NSAIDs can cause GI side effects and resistance. So, this combination is effective in various indications such as irritable bowel syndrome, UTI, polycystic ovarian, pelvic inflammatory disease, fibroids, etc. So, hyoscine butyl bromide and paracetamol effectively reduces pain symptom in women. Thank you. Thank you so much for a patient hearing.
Thank you so much, ma'am. So I am requesting all the doctor, if there